Imagine a time when reaching your golden years brought not just wisdom and relaxation, but also a deep fear of illness and the crushing costs of medical care. Many families faced heartbreaking choices between essential treatments and financial ruin for their aging loved ones. It was a situation that highlighted a significant gap in America's social safety net, affecting countless individuals and their children. During the 1960s, the primary beneficiaries of Medicare were older Americans, specifically those aged 65 and over. This landmark program also provided crucial assistance to individuals under 65 with certain long-term disabilities, though that provision came into effect a few years later. The goal was to provide access to medical care and financial security where little existed before. The core mechanism behind this benefit was the Social Security Act amendments of 1965, signed into law by President Lyndon B. Johnson. Before Medicare, many seniors could not afford private health insurance or were denied coverage due to pre-existing conditions. Medicare stepped in to fill this void, offering comprehensive hospital insurance, known as Medicare Part A, and supplementary medical insurance, or Medicare Part B, for doctors' services and outpatient care. This meant that the financial burden of a sudden illness or chronic condition was significantly reduced for millions. For everyday Americans, understanding this shift helps us grasp the immense social transformation of the 1960s. It meant that retirement planning could focus less on potential medical catastrophe and more on enjoying life after work. It provided a sense of dignity and security, knowing that necessary medical attention was within reach without depleting life savings or becoming a burden on family members. Hospitals also saw a change as more people could afford to access their services, leading to greater stability in healthcare provision. This initiative was a cornerstone of President Johnson's vision for a great society. A particularly touching detail is that former President Harry S. Truman, a longtime advocate for national health insurance, was issued the very first Medicare card. This symbolic gesture underscored the decades of effort that finally culminated in a system designed to protect America's seniors. It was not just about medical bills, but about affirming a societal commitment to the well-being of its oldest citizens. Ultimately, the establishment of Medicare in the 1960s provided an invaluable safety net for older Americans, protecting them from the devastating financial impact of illness. It allowed them to access necessary health care, fostering a greater sense of security and stability in their lives. This program created a fundamental shift in how the nation cared for its aging population, leaving a lasting legacy of support and compassion that continues to benefit millions today.